Okay. Well, let's go ahead and get started. I know we still have some folks joining, but we really welcome you all. Hello to everyone. Welcome to our communications training series for community leaders. I am Jacquelyn Dalton, Director of the Health Equity Community Collaborative, or HECC at Health Leads, and I'm so glad to have you all here today. For those who are new to HECC, we are a collaboration born out of the belief that no one organization or institution even can tackle all of the health equity inequities issues that we have alone. And so we try to work together to advance health equity by cultivating a sense of belonging and collective care and a sense of shared power, especially in the systems that are designed to serve us all. So we really want to see that through our collaborative and the work that we do with each of you. And so this training is actually one of the ways that we work to build collective capacity and try to build power with one another. This is a session that has been shaped by the feedback that we have gotten from everyone in our network, those who are joining today. And this is also the first of a three-part series that is really designed to give community-based and public health organizations, nonprofits, right, community leaders, or access to real tools and strategies to meet some of today's challenges, communications challenges head on, right? And so I'm pretty excited for today's presentations and the activities that we have planned for you all, because a lot of planning, thought, collaboration has gone into making today's session happen. And I believe many of you will actually find it quite valuable, quite beneficial in your day-to-day work. So let's go ahead and jump in. If we can go to the next slide. Just a few quick notes before we begin. Today's session is being recorded and we will send it out to you all, everyone who has registered, right? Recently, we've had some community gathering sessions and we've chosen not to record those sessions just to allow more of a safe space. But for the sessions that HECC hosts that are more content focused, we will be recording those sessions and sharing out content with you all today. And so we also will have time for some Q&A at the end. So please feel free to use the chat and we'll have some time for folks to be in one-on-one sessions. So feel free to unmute at that time. But when we're not in the sessions, we do ask you to stay on mute. Speaking of the chat, we welcome you to introduce yourself. I know some of folks are already doing that already. So the chat is open. Go ahead and put in your name, your organization, where you're joining from. I know we have folks from all over. And anything else you might include to introduce yourself. I personally love an emoji. That's just me. Maybe you do too. So anything you want to use to introduce yourself, we welcome that in the chat, as well as any questions or comments that you have throughout the session. Additionally, if you would like to use closed captions, those are available as well. And we welcome you to use that by clicking on the CC icon within the Zoom toolbar. Next slide, please. On this next slide, some of you may see this, so it may be familiar to you if you've joined some of our previous sessions. But for those of you who have not seen this slide, many of the HECC sessions are interactive and we allow time for connecting in small groups. And when we do that, we do ask that you try to keep these agreements in mind and try to uphold them in how you show up with others on the call today. So we ask that you make space for everyone to participate, to be open to acknowledging systems of domination, such as racism or capitalism, patriarchy, as well as the norms that those things tend to maintain, such as inequality. We also ask that you are welcoming and that you hold space for tension, try to keep each other accountable, lead with curiosity, right? Not judgment like Planet Fitness. So no judgment, but more so curiosity and kindness. And also just try to cultivate a sense of belonging as well as healing in these spaces. And on our next slide, we actually have our presenters today. So I'll be your moderator today, but we are thrilled to have some incredible guests and presenters. So we have Dr. Rebecca Ivic, who is a Associate Dean of Research and a Professor of Health Communications at the University of Alabama, as well as the Senior Editor of the Journal of Health Communications. And then we have one of our HECC core partners, Dr. Scott Ratzan, Editor-in-Chief of the Journal of Health Communications, as well as our final presenter, who's one of my Health Leads colleagues, Sue McCarron, who is the VP of Strategic Communications at Health Leads. And so each one of these presenters actually brings a deep amount of knowledge and expertise, as well as practical experience in many facets of communications today. And so as we get into our presentations, we also wanted to just give you a little snapshot of what you can expect today in our session. And so on the next slide, we actually have sort of an agenda of what we plan to do today. And so we will start off with a presentation about active listening, building trust. Then we'll have a presentation on sort of crafting a compelling narrative about your organization or advocacy issue, as well as some time to workshop or practice as well. And then lastly, we will have time for a Q&A with our presenters. And so as many of you know, the field of communications is very vast, right? There's so much that we could cover today. And so we tried to make today's session about topics that are based on what we heard through your feedback, essentially, as I mentioned before, and feedback that we've received from the HECC network. So we won't be diving into any social media algorithms. We won't be talking about the ins and outs of specific platforms today. Instead, this is really something that you can think of as a launching point, right? In each of our following sessions, we'll go more deeply into some of the topics that we talk about today, but this is really a place to build your skills, connect with others, and have some time to practice. So like I said, in other sessions, we'll go deeper. We'll try to review your feedback in between sessions and make sure that we are aligning the sessions with your priorities and your needs as much as possible along the way. So with all that said, I think it's time for us to get started. So let's go ahead and jump in. I'm going to go ahead and turn it over to Scott and Rebecca.
Great. Thank you. Good morning, good afternoon. It's really exciting to see many of you who are on here today. Thank Jacquelyn for not only moderating, but the great work she does on leading the Health Equity Community Collaborative. We have other core partners I see in the chat, Denise Octavia Smith and Alexandra Quinn and others. So we're really excited about this today. Both Becky or Dr. Ivic, as I say here, are really excited about what we're able to deliver and talk to you about. We are dedicated to advancing quality health communication, and we have a number of different projects that we do both locally. I'm based at CUNY School of Public Health in the city of New York. We have an online master's program in health communication for social change. Some of the pieces we'll be talking about today will be brought not only from the ideas that we espouse in the program, we're in a community health and social science department, but also a lot of the work that Professor Ivic and I have been working on with this Nature Medicine Commission on Quality Health Information for All that the Health Equity Community Collaborative is also a part of. So with that, we want to get right into it. Yes, both wear academic hats as professors, but we want to make this really valuable and interactive. So we've tried to design this. I want to thank Sue and Jacquelyn and the whole Health Leads team who've done these so well. And the theme that we are all wanting to embody is belonging. So we want to make this a value to all of you. And know that this is one of three parts of a communication series, but we want to really hear from you, and we already have information that you put forward on the screener for this call that we're going to go through some of that and hopefully address your interest. So feel free to use the chat, as Jacquelyn has said, and we're looking forward to more. With that, I'll turn it over to Professor Ivic to begin our activities here.
Hi, I'd just like to introduce myself. I'm Rebecca Ivic. Feel free to call me Becky. I'm here at the University of Alabama. I see so many of you engaging in the chat, and I'm trying to respond and share some emojis and engage. I've had the pleasure to attend listening sessions from this group in the past, and they were just wonderful. And so I really do want to engage with everyone. I just want to kind of introduce my college as well. I'm at the College of Communication and Information Sciences, and I see several Alabama folks, and as well as I'm from Cleveland originally. I see some Cleveland faces as well. So do engage and connect. I'd love for this to be very interactive as well. I'm also a college affiliate with our College of Public Health, and so I wear multiple hats hats, as Scott mentioned. A lot of the work that we engage with is promoting quality health information, and I also engage in developing and building health campaigns, community interventions, and really promoting health and well-being for the public good, and engage in working with a number of students across a range of areas, both in the state, regionally, nationally, and globally. And so it's a true pleasure to be able to engage with all of you today. Sessions like this, I think, are the best because they're an opportunity for us to work together and learn from each other. And so with that, I think we can go ahead and move on. Scott, you're muted.
Great. So we figured we would jump right into it. And we would like you all to answer this question. How concerned are you about quality health information or confusion around health issues in your community? And this is just an example on the right in last number of days what is out there to prod. But please, yes, I see we've got you're all answering very quickly. So, as we continue to trend, uh, it's very clear that there's a concern, and I don't know if we could say we're self-selected by all of us on this call, but this is following really national surveys, whether they're done by Pew, Kaiser Family Foundation, and all the other groups that are out there. This is a huge concern for us. And the concern, some people would say, oh, is it misinformation? Is it false information? Is it misleading information? Is it information that is just frankly meant to deceive? Some people call that disinformation. So I'm going to close out the poll. I see we have almost 150 respondents. So with that, I'm going to end it and see if we get to now see the results.
Yes, I see that we've got 95 are saying, so 63% extremely concerned, and 29% then the next is moderately concerned. So there's a good proportion of respondents in that extremely concerned section.
Right. So nearly 2 out of 3 people here are extremely concerned to what's
Yeah.
going on. And the unfortunate thing, if I can say that in our environment, is that communication is a dynamic environment, right? So one day it's measles, but measles is going on every single day right now, and the potential to continue to tear across this country and come back as we know that it never has, or not since the year 2000 when it was officially basically eliminated in the U.S. We see the issues with fluoridation. That was yesterday's news already, talking about the towns that are ready to move away, and we know that there's some legislation that's under consideration in the federal government to make that happen, if I can say that, in a more negative way, that fluoridation is going to be under question. And that's been around since the late 1940s, saving hundreds or if not thousands, the immigrant issue and all of the others that are there. So, I think, overall, this is unfortunately an issue that we know we're going to have to address. We can't necessarily just turn our heads and think that it will go away on its own. Just as when rumors get started, they often do not go away and they find their way into the cultural understanding. So we're going to talk about ways to address this. These are ways that you could be, whether it's interviewed on a radio, a local show, talking to friends at a religious event or a community event or whatever it might be. So, overall, thank you all for answering this. We think that's, of course, why we're maybe here today. And those of us in communication know that this is a lifelong experience that we're going to be able to go through and address in a hopefully a positive way. So with that, I think we'll go to the next slide. And I'm going to turn it over to Dr. Ivic, would like to lead you through what our field of health communication.
Great. And I'm going to try not to take too long in discussing what health communication is so that we can get to some active examples with this. So when we're talking about health communication and getting information out there, I want to talk with sort of what health communication is from a really simple, but really the power of what health communication can do. Given where I'm seeing where a lot of us come from, I'm seeing that we have professionals that are working across organizational equity and folks that are working on health communication for social change and just a range of professions. So at its core, what health communication does is help us to make sure we're getting the right information that reaches the right people at the right time. And so that's a lot as it is. That's a lot for us to do in a way that we really want to make informed decisions. So that includes repeated and engaged interactions where we're trying to build trust. We're trying to build trust with our communities. We're trying to build trust over time. And that means that it really is a two-way interactive process. It's not a one-way street where we're sending out messages on social media or disseminating information or giving that information, but we're trying to build sort of a shared responsibility as communities, maybe as health workers. Each of us play a role in whatever capacity we're doing. And so it's a nonlinear process that requires really a secular role of listening, understanding, really responding and adapting our message strategies over time. So if we're working on our communication strategies through a health lens, we may have to co-develop or adapt materials as we listen to our communities and see what the response is. And as the previous slide showed, with so many issues that are facing us and there's really no lack of shortage of those, we have to respond accordingly and respond to how our communities react and really meet people where they're at. So with today's session, what we really want to talk about is how to go beyond sharing information and really work towards building trusting relationships and building shared relationships where we're communicating that important, vital information that we have and supporting health decisions. And so later on today, you'll hear some examples from Scott and from Sue as well in terms of ways that we can actually engage with that. Next slide, please. Okay, so with our active listening examples, I do want to introduce this by talking a bit about, before I talk about the examples that we have on hand, communication really as ongoing engagement, so that we understand how to position these active examples. So for instance, in many of our communities and organizations, we often we might be working in our organizations to say, post on social media or deliver other materials, flyers, other examples that I just mentioned. But those are not really where the end of that communication it is. Rather, we might think of that as the beginning. That might be our starting point. And I say that knowing that that's a really difficult process as it is because it takes so much time to develop those materials. But if we think of health communication and the strategies as a series of those repeated and engaged interactions to build trust, then the way we might look at this really is this is the starting point. And so with those repeated engagements and adaptations over time, then what we need to do then is invite those community voices, trusted leaders within our communities to listen, to learn, to adjust, and to keep going. And that's why when we do so, we can co-create messages with our communities. And so with that, when we look at these active listening examples, we might think of these as how do we show up in conversations? How do we show up in our communities, in the organizations with which we work? I see that we've got several students engaged, and you're thinking about perhaps how you might engage professionally, or maybe you already are in many ways. Are we talking at people? So we've got these traditional approaches versus these active listening approaches, or are we talking with them? And so traditional health messaging often comes across as I'm an expert, my role is to persuade, or my role is to share information and do what is right for this health cause or this issue. And so an active listening approach in health communication is thinking of ourselves as guides, where we're thinking of engaging communities and engaging others in an open conversation and in an open discussion about concerns. This helps us when we think about even developing the materials that we create. It helps us think about how we learn to listen to others and to be here as a guide rather than someone that is solely the expert. We still bring expertise. Each of us have that, but we're also thinking about what else can we do to also learn from each other? What is important to those that we are delivering that message to meet people where they are at? Oftentimes, we are coming from a place that, for instance, let's say that we understand that everyone at their core, we want to be healthy. We want to make good choices, and that people may simply have different concerns, barriers, beliefs, and experiences. So we need to meet people where they're at and consider how we can learn from each other to deliver a message and to create those messages in a way that meets people, in a way where we can start with a starting point that meets them appropriately. And so we want to make sure that we're supporting autonomy and that we're respecting those communities that we're working with, knowing that some of their values and their beliefs may be different, but that may be a way for them to openly share their concerns with us so that we can develop appropriate messages. As a result, we're shifting from this mindset, this top example of I'm an expert and I'm trying to persuade, to instead thinking, if I respect communities and individuals, then I'm working on listening to my community, listening to the people I'm working with, to building trust. And by building trust, then we're working towards building and developing health messaging that really works to actually then move towards that role of persuasion, but it's doing so in a way that listens, understands people where they're at. So with that, I'm going to pass it on to Scott to give some examples, and we're going to hear from Sue later on actually developing stories and working together on some more of this later on today.
Great. Well, thank you. Thank you, Becky. And, as Dr. Ivic mentioned, this is really what active listening is all about. It's two ways, it's interactive, it's engaging the communities. And one thing that we remind is just posting something on social media, developing a flyer, thinking that you're able to have a single event is not something that's going to make a difference on its own. It's said in the old days, it used to be you need to reach people 7 times with different ways, whether it's I heard it from my friend, I heard it from my neighbor, I heard it from my boss, I heard it on the radio, I saw it on TV. That would get people to say, okay, I'm ready to make a difference. Now, it may be multiple citations or multiple ways with social media, but it's a repeated and engaged interaction. And what we have found over time, this also is important that it's from a trusted source. And I think Becky had nailed it, that the trusted sources that we're referring to are people like you who are listening and people who are like you are part of the community, and not thinking it's the old days of a trusted source in people in white coats or people wearing ties on an evening news. The world has changed and it is nonlinear. There's this cycles of understanding that Becky just mentioned. And not only understanding, but again, testing and assessing, are we right? Are we on the correct message? Is that message resonating appropriately? And how do we adapt that as time changes? Just as it's going to with the fluoridation example, other examples that Sue will mention later in this, and you'll have the opportunity for interaction. The co-development, and that is a not only a guiding principle of the work of Health Equity Community Collaborative, but also the work that many of you do, we hope. And with that, we want to remind what that means of having the community truly co-develop it, and then focus on connection, relationships, and resonance. It's not just reach, it's also the relationships, and trusting relationships, as we know, don't happen in a day. And the examples that Becky just gave hopefully will hone in. And as you know, you'll have ability to get these slides at the end of this session. So with that, I'm gonna pivot to one of the biggest examples that we've been engaged at the School of Public Health that I'm in at CUNY in New York. We have done a lot of different research. The Journal of Health Communication, we have a whole special issue and book on vaccine communication in a pandemic, but this that I'm going to talk about is from the pandemic, but is really still applicable today. So the idea of vaccine hesitancy came along really before COVID, and it was called one of the top 10 issues in the world by the World Health Organization. And all of a sudden, people started raising their hand or saying, oh, I'm vaccine hesitant, or I'm able to be in a vaccine hesitant group. And we've been quite worried, as it says on the right, that policymakers and planners basically said, oh, let's just focus on those that are vaccine hesitant, or let's just find them. And they continue to cite polls, and the polls drive news, and the whole, as you know, those of you who've studied communication are engaged, that polls often also help direct the dialogue in different ways. So we've been very negative on using the word vaccine hesitant. We like to use the word vaccine confident. So the article that was published in the New England Journal of Medicine on the left, we mentioned the characterization of vaccine hesitancy in this case as a useful approximation, but it underestimates the variability and stages of readiness, the fluidity of people's views, and the persuasive power of access to health professionals embedded in the communities where they live and work. Now, we used the word health professionals here for the communities because it was in the New England Journal of Medicine, and we were trying to get primary care physicians. But we have found this across the board. So to look on the left, this article was based on 140,000 people in 10 states that were going to the doctor, and in the waiting room there was this patient information software that you fill out, and we would ask them, are you ready to get a vaccine today? And 40%, this is in May during COVID, so they were vaccinated, but over half, right, were not vaccinated. And people in the press and those were saying, oh, it's going to be very difficult, they're all vaccine hesitant. But we found they weren't hesitant. They were ready. And the problem was, if you recall, it was access. And still, access is one of the key issues that we have to think about in terms of vaccination. But it's access to information, it's access to getting, in this case, the vaccine and so forth. So we are trying to suggest, when you frame an issue, to really think of the consequences and how we talk about it. So we were trying to call people vaccine ready. They were ready, they just couldn't go, they weren't able to have access to get online to book a place in their stadium or get to whatever place their vaccine was. Or they were receptive, they just needed a doctor or their friend or community or religious leader to say, hey, you should get vaccinated. So they just needed one little piece from their community that would make a difference. And then some people were just neutral. You just needed to convince me. We might call them the late adopters, or they needed to hear this from more than one person, and they were convincible. Now, the 11% were certainly resistant, and there still might be, those are the people that might be very resistant to, for example, getting their kids vaccinated for measles. But that doesn't mean we have to forget about the 89% in this case. The social norm in society is to take care of the health of yourself and your family, and people care about it. But we have to figure out ways that we don't talk about the negative only. And in this case, the word that we would like to use would be vaccine confidence. Because it also got charged to being, are you vaccine confident or are you vaccine hesitant? We came up with another term, which is the next slide. And it's a program that we developed in New York City and Westchester County. And it dealt with the idea of vaccine literacy. And basically what this comes down to is a lot of work on the left that we all think we do in going to school and health education and others, is we just need to give people skills and ability. We just need to tell them, this is what you need to do to make the healthy choice. But in reality, we know you can't always make the healthy choice if on the right side, we have a system that doesn't allow it. If you don't have a healthy choice to go see a doctor or a community health center for preventive care, there's a problem. So we need to work on both sides of the equation, having people educated to help make appropriate decisions, in the system to deliver appropriately in a simple way. We can talk all we want, well, we will be talking, unfortunately, with this big, beautiful bill or HR1 that is going to work on making it more difficult on the right side. There are not simpler systems. It's going to be more difficult to continue to have your children enrolled in Medicaid, Medicaid in general, all these other challenges that we face. So we have to work both on the left on our consumer perspectives to give people the information and the knowledge they need. And on the right, oftentimes through advocacy or our roles in the system to simplify, to help people have both health and vaccine literacy. But the piece we're focusing on today is we can't change the system in a snap, and it's going to take a lot of work on both the state, federal, and local levels to deliver quality health care. And it's going to be more difficult. And it takes time in schools, in the community to give people the skills and ability. So we've got to try to speed things up and engage as best we can with what we know we can do. And that's coming down from the top. Communication and digital community influence. How do we do that? We're going to talk a little bit about that more today. We have some examples here. Again, we tried this vaccine literacy piece. It's called vaccineliteracycampaign.org. You can find a lot of resources there, health leads, and we work together on this, some in Spanish with doulas, with a variety of groups, but still there's a lot that needs to be done, and it's an ongoing base. And that's why, frankly, and I'll call out to Maggie in the chat who says she's enrolling in the Health Communication for Social Change online program that we offer, but also these kind of short examples that we give today, you can put into action. You don't need to get a degree. Some of you already have degrees, but we're here to help, and we're here to also work with our Health Equity Community Collaborative to do this. So with that, I'll go to the next slide. And I want to thank all of you who are putting these emojis and parts forward. So in our world, and I know those of us in health know that there's, this is probably one of the most professionalized and certified fields of getting information published. So we actually worked to publish a bibliography on vaccine literacy. We wanted to show that this is possible. And two of our graduate students led this, and a librarian from the National Library of Medicine and Ruth Parker at Emory, who leads health literacy work. And we just tried to show that with all these pieces that have been done over the years, communication is really central, and community level is something that interventionists are important. So this is the definition. Vaccine literacy occurs when the skills and abilities, so that left side of the equation of people, align with the content, processes, and systems needed to access and get vaccinated. And we believe in the vaccine example, it's also knowing how and why vaccines work, the diseases they prevent, and their value to yourself and society. And the next slides will show there's ways to answer just using this. And I'm going to let Dr. Ivic also jump in as we're going through these next slides. This whole bibliography is posted on vaccineliteracy.org, I believe, and also published in the journal as mentioned here. So the next slide. We're going to try to use this example of vaccine literacy, that again, moving to building vaccine confidence, working with a community objective to build effective communication, to respect the appropriate influence and the ongoing engagement. So people will know where to go back to. Is it my community health center? Is it the primary care physician I spoke to? Is it the health educator at the school? Is it the school communicating that everybody needs to be vaccinated when it's back to school time, because we want to protect people not only who are at school, but people who are working in our whole community. So these are conversations that we want to figure ways to have them in different places at different times and have a quality lens on. Because again, relationship building is key, and the trust that we think is so important is not easily done. It's a process. It's not a product. And we believe, and I can almost say that we've been using the word public health. Public health is community health, or community health is public health. And we need to start with the community, particularly now, to build the dialogue, and don't expect it to come from the top down. And I think I know one of our questions later is, what do you do when the top down or something from Washington or Atlanta doesn't match your viewpoints or the science or evidence base that you are accustomed to or believe is appropriate? How can you continue to have this community dialogue and trust that is so key to our future? So we'll go to the next slide, please. And we only have a few of these. So here's the example. And this is the one that, maybe I'll pause a little bit and also let Becky chime in. So the idea was, if somebody's asking you, this is more of are you interested in getting your flu shot this fall, which we know the flu shot has been around, for decades. Every year, it does prevent a lot of people from getting flu or even dying from flu. The flu actually is still quite one contagious, virulent, and unfortunately, people who are immunocompromised or others who may not even know have bad consequences from the flu. So many times, as you ask people, they'll say, I'm not interested in getting vaccinated. I keep hearing that vaccines cause other health problems and diseases they're supposed to prevent. So, for example, we've heard that from the current Secretary of Health and Human Services, RFK Jr., who has said that, oh, well, people die every year from measles. Well, they do in different parts of the world. They haven't in the United States to the same level that they are now. So we need to be able to have facts on some of those. We also continue to hear, and you will hear, the ongoing questioning of the vaccine autism link. There is no link. It's been debunked by science and so forth, but that also will come from whether it's Washington, whether it's other places of the federal government, of people questioning this. So we think the first part is not necessarily going, oh, that's wrong. The first part you need to say is, okay, let's go back to the question at hand. You don't think this vaccine is right for you. Would you be willing to share some of your concerns? So the most important piece is to keep the dialogue and advance it in an open way. And this is an example. I'm sure you've all been through this, maybe some of you with family and friends. I don't know, Becky, if you want to add anything from your perspective on this.
Yeah, this gets right back to what we were discussing with, what is health communication? How do we advance building trust? Is sometimes when we are meeting people where they're at, it means if someone is saying, like in this example, it sounds like you're not sure the vaccine is right for you. Would you be willing to share those concerns? That opens it up to having that dialogue as a starting point. And so by building that line of questioning, it opens it up as a nice point of discussion rather than us trying to say, here are the facts, here's why you need this, but rather opening it up for starting from the same point, because we all agree, and there's at least a base that we agree health is important, even if the angle at which we come from it is different. And I understand, and in seeing some of the dialogue that we're talking about in the chat, there are situations where we know that's going to be extremely challenging. But in other contexts, there are strategies we can work towards, broadly speaking, where this is a way where we can work towards reflecting and asking questions that in many cases can be quite effective.
Great. So it is so easy to hear something and to go right at people. No, that's wrong. Or everybody else is getting it because why would you be different? So the real piece is to try to understand the concerns. And I know we're going to try to address some of these in the chat because some of the concerns, yes, when it comes from the government, I follow it, or even worse, in some places, right? It comes from the government. I know I won't follow it. So we have to figure, there are some pieces that are trustworthy, and how do we parse those out? So first, ask about concerns. The next slide, please. We'll talk about the next step. Reflect and affirm. So, okay, you're concerned. Why is that? Well, somebody might be pregnant. I can't risk the vaccine harming my baby. I've also heard that new studies say vaccines may be linked to autism and diseases. So again, sort of reflect. Okay, you're worried that the vaccine will be bad for your baby's health. That's legitimate. You're very concerned probably about all sorts of things during your pregnancy. And that's excellent that you're actually thinking about your baby. And affirm, okay, that's understandably scary about the risks that you think may be there. Your baby's your priority and you don't want to risk their health. So let's talk more. You'll see as we go to the next slide, how do we then bridge back to what we're trying to get people to make the best health decision for themselves? So the next piece is there more information that you might need about vaccines and pregnancy? Uh, Hopefully the person is going to say, sure. I mean, you've already affirmed, you've recognized their interest, you've recognized their concerns, and now you're building trust that you're the person who's able to inform them or to point them to the place to inform them. So right, as Becky suggested, yes, you can point them to studies. Some people might want studies that are out there. some that may be published, some that might be studies in their community or people they trust. Reaffirm, vaccines are important for your baby's health, and you can even say, for your health. People may have got their tetanus shot, hopefully before or during pregnancy, even if need be. They've been found to be safe for pregnant people and their babies. Also, some vaccinations help protect their baby when they're young. And there's lots of examples of this that are also, if anybody's using those social media apps or even the old Text for Baby interactive piece, a lot of these reminded people that about vaccination, prenatal care, going to those kind of visits and so forth that are there. So there's an opportunity to inform. And this is also the place that you could refer. Here's either a website or here's a brochure or here's something from our community health center that's there. And then finally, does this information
Yeah.
make you feel better about your concerns?
Yes.
Do you think you'd be willing to get it?
And what I would just add to what Scott had said is what I like about this example so much is that it still doesn't end with the persuasive aspect, but the onus is placed back on the individual where we're still saying, how does this make you feel? Does this make you feel better? Do you think it's still not you as the expert saying, great, go do this. It's still putting the power onto the individual, so they're making the decision, but they're empowered with that information.
Absolutely. No, and thank you. And while I've been mentioning the connection to resources, it's really the final, the step forward that we have here is to connect to the resources. So we'll go to the next slide. Um, and as Becky's saying, it is really important to connect and to build and to let them know that you are either the intermediary to help them find the resources or the intermediary to help them interpret those resources. So hopefully, by this point, all right, I will have the vaccine. How do I get it? And that might be another piece of the access issue, helping them find that. You made a decision today that will protect you and your baby. Would you like me to help schedule an appointment for you? Or do you know where to go for it, or the other pieces that are there? Those are the easier ones. I still don't want the vaccine. Okay, so okay, you're not interested in getting it right now. That's okay. Thank you for taking the time, but yet not necessarily ending it there. I can give you some information to take home. Feel free to reach out if you have the questions, or I can give you some information to see on your phone or to join certain groups. This is where it's very tricky, right? Because many of them, it's easier to find negative health information on vaccines than positive. The vaccine information groups that some of them seem that they're legitimate are not at all. Like the vaccine information, there's a couple of centers that are there that are formerly groups by anti-vaxxers. A lot of pieces that are there also exist. I'm not going to call all of them out, but I think it's really important that you try to connect them to resources that are accurate, are in a language and a level that people can understand, have some of the cultural competencies that's there. And also, since many of you are community health leaders or leaders in your community who work with community health leaders, that you're able to also let people know that there's some confidence that getting the vaccine would be helpful. The final piece here is, of course, to warn people, do you know the warning signs if your child or someone has measles? Do you know what can happen with that? You can also build up that there are other consequences to consider when you look at this information again, and particularly give the information that you might know that puts others at risk. This is the kind of piece that is really important. We're doing our best to make these resources simple. Health Leads and the Health Equity Community Collaborative here, we've been working on some of these resources. At the end of this training today, we're going to have a checklist that we'll share, and then a checklist that you're able to get that'll be downloadable. That will give you also opportunities of pulling it out of your desk drawer or even having a screenshot of what it might be for your phone. So you can think about how to address challenges, whether it's on vaccination, on getting coverage for yourself or your family, on any health coverage or what it might be, given the current changes that will be there, as well as addressing, some of the issues that might seem like the disease du jour of the week that might not necessarily be accurate or is not at the same quality level. Becky, I know you're on edge to add to this.
Yes. So I think that what I like about these examples is that there are two active approaches for both connecting with an affirmative choice and one where someone still doesn't want to, say, engage in the behavior. And so in this case, it's someone who may not want the vaccine. And so what I like here is that they receive some information, so there is an active component here, and they have the opportunity to follow up if needed. And again, I understand that this does not always work. I've been engaged with, there was a statewide CDC initiative during COVID-19 where I worked with some of the some really rural communities in the state of Alabama. And part of that initiative was to get people information on nutrition, on basic health information and things that they could do that were available to them in very small communities where information wasn't necessarily available, and to reach people where essentially where they're at, the things that we're talking about. And so in some cases, when we were developing messaging for that, there were people who didn't want to engage. And the idea was to make sure that these were the exact strategies used were get them information that met them where they were at. And if people didn't want to engage, that is great too. Here they still get the same material. Here's follow-up contact information. And generally speaking, that went really well. So that's all I'll really add there. But I think this is a really effective way to really work with people because it empowers them. It gives empowerment and puts that choice into the hands of community members.
Yes, and just very well said of what's been done in Alabama. And I could say the work that we do in the city of New York, whether it's with our Harlem Strong initiative, where we're going to do something very different than we might do even in another borough in New York. And it was very different even in the Spanish-speaking communities when you're talking about where they want to get their information or how they want to get it. Some people would like to go to a retail site or a religious site. Others would prefer not to. And it really can go down to sometimes a zip code basis or community basis. And that's why we don't want to forget the listening part that's so important as we start all of this. Excuse me. So with that, we're really excited to be able to start this communication series. We do know that again, there'll be at least 3 of these, and we're going to have more opportunity to hear from you on a poll and then address this later with Sue McCarron and others. So with that, shall we go to the next slide and do our poll? Great. I think this one we're able to suggest 5 areas that are here. That doesn't mean there aren't more. So we're also going to give you the opportunity if you say, oh, we forgot the most challenging part to communicate with your community, or you can see you could put more than one, please add those also in the chat. That will be important because again, the checklist that we're going to have at the end of the day will be of value, but we're also going to be designing, future sessions after today, and are, really hopeful that not only the sessions, but the time in between, the kind of resources and, technical support we might be able to help on also will be an opportunity for engagement. So, as mentioned, we'll show the results of this poll, the survey. Let me just say for both Dr. Ivic and myself, we're enthusiastic about the value of communication. We know from the work that we've done, by the work that's been published over decades, and the work that all of you do, that communication can make a difference. Communication also, if it's done poorly, doesn't always get the intended response. And the next part of this webinar today, we'll be talking about ways to help craft things in a positive way to address those challenges that we face. And you'll see I will show the results of this poll that basically have 3 issues that are right at the top, from coverage of Medicaid, immigration, and vaccines. And they're all sort of fighting for the first. Then we have so number 1 is immigration. Number 2 is coverage. Number 3, vaccines. Number 4, funding for local work and initiatives. 5 homelessness, 6 food security, and again, I think a lot of you are in safe drinking water to the end here. We're going to share these results now so everybody can see them. And then I'm going to turn this back over to our moderator, and we'll then further be introducing Sue McCarron. And we've tried to really define a great session for you. So please keep putting stuff in the chat. And back to you, Jacquelyn. Thanks.
Thanks, Scott, and thank you, Rebecca. Or I should say Dr. Ratzan and Dr. Ivic, because you guys are providing a lot of information for us and really breaking it down. So really appreciate you all for grounding us in what quality health information looks like, how to engage our communities more effectively around it as well. I personally love the method of really going beyond just sharing information, right? Everyone's sharing information online. But when you mentioned really starting with the intention of building trust, I think that's so key. Especially being intentional about not focusing on the negative and using more of a positive tone, not just the tone or mindset, but really thinking about the language that you're using and making sure that's positive and making space to consider folks' valid concerns that are out there. That's really important. And really thinking about one thing that stuck with me as well is shifting from the expert mindset. And that's truly key, especially in different spaces. When we have information, we think you need this, right? Take this, share it. But really, it starts with what Scott was saying of building those relationships and being, making those seeds of becoming a trusted messenger, and not just for the moment, but for years to come. So really, thank you both for that insightful presentation. I believe we're going to take a 5-minute break. And I'm saying that looking at my folks on the screen. Are we taking the break? Just want to get the confirmation from the team.
I think we can take a quick break, right?
Okay, we're going to take a few minutes of a break. Feel free to grab some water. We know this is a long session, so we wanted to take a small break, let you stretch, get whatever you need, and we'll come back and resume here shortly. All right, well, I'm going to welcome you all back. Welcome back, everyone. Now we are shifting gears to dive into something that many of you share that you're grappling with in your feedback, right? Crafting messages that truly resonate. So please join me in welcoming my colleague, Sue McCarron. Sue, I'll turn it over to you.
Awesome. Hi, everybody. Thank you so much, Jacquelyn. And thank you to Becky and Scott for that awesome first part of our session. I think it was really incredible grounding around a lot of the challenges that we're all facing. And it's so great to be with you all today. My name is Sue McCarron. I am the lead of communications for Health Leads and the lead of communications for the Health Equity Community Collaborative. And I have been with Health Leads. I'm going to be hitting my 10-year anniversary this fall. And prior to that, my career was really in the healthcare consulting side. So I led a communications practice at a global communications firm where I worked mostly with healthcare companies. And a lot of my work was really focused on helping different parts of healthcare organizations tell the story that they really wanted to tell and cut through the noise in a really loud and crowded market. And so I've really enjoyed that work. And so this portion of the training is going to shift a little bit into what does that look like? How do we actually, I'm going to provide a bit of a framework for how you might be able to think about not only talking about your own work and initiatives, but a lot of these difficult issues that are coming up for your communities, understanding how do I get a message across. And so I'm really thrilled to lead you all through that. I will also say I'm originally from Warwick, Rhode Island. I saw there was somebody from Warwick here, so props to you. And now I'm based outside of the Boston area, so shout out to all the East Coast folks. Okay, next slide. So I have a couple prompts here that I'm going to ask you all to think about before we move into the exercise itself. So drop in the chat. We had such great interaction in the registration form for this training, where people really uplifted a lot of questions about what they wanted and needed around communications. We understand that a lot of you are working with limited resources, limited teams. but you have a lot to say. And so I'm curious what stresses you out the most about messaging and communications work right now. Feel free to share in the chat. But these are just some things that have come up not only in my own work, but just in things that we have heard from you all. How do we use stories and explain the magnitude of a problem without exploiting different groups? How are we responding to breaking news, like with something unique and important to say, like a point of view, but also be a reliable resource for the community? How do you describe the value and the impact of your work or an initiative, like very clearly and very simply when there's so much out there in terms of information to share about your work or to grab attention around funding or whatever it might be? How do you tailor a message for different audience and different channels? And then from there, how do you even understand which channels to invest in, right? And then I think a common one we hear is also ensuring that your staff or the group you're working with are, kind of like singing from the same choir book, right? Like ensuring that the message is consistent around everything that you're trying to get across and that everybody's aligned trying to say the same thing. So there's no shortage of questions that we see here. And I'm just going to flip through the chat really quickly, but yeah, I think there's a lot here around, yes, standing out amidst the noise is something I think a lot about. I think I see a lot in here about tailoring messages. Yeah, I think like this idea of avoiding misinterpretation, and taking, making sure that you're getting your message into different channels and how to know where to go with that. So this all resonates with me. And then a question around like, what does the plan look like, right? And as Scott mentioned earlier, we do have a framework for you, a resource to help you think about like how to start that broader planning. But for today, so we can move to the next slide, I can kind of get into what we're gonna talk through here. So this one has a bit of a build, Danielle. So you can click, here. So oftentimes when I'm thinking about building out any kind of communication, there's an order of operations to this. So a lot of times I hear someone will come and say, like, I really want to do a webinar, or I really want to do a social media campaign. But that's a little bit chicken and an egg, right? Because a lot of times I'll dig into that a little bit and say, well, why is that? Like, what are you looking to achieve? And then when you ask these questions first, so audience is usually where you would start, right? So thinking about who are you speaking to and why, what do they care about, where do they get their content and information, and spending a little time there first is really the question you want to think about before you jump right to the content or the channel, right? So I think that's a common challenge where people know they not want to get something out in a particular way or put something on a website, or they think maybe a webinar or a toolkit is the best way to do that, but haven't really done the thinking up front to get to that determination. It's a little bit of a guess, right? So I was going to say another question for you all is, as you think about your own audiences, and I know this can be very varied, right? But depending on who you're trying to speak to, but drop in the chat, do you have a particular audience that's most critical right now to understanding your message? And there could be so many different types, right? But maybe there are top 3, right, that you're working on all the time, or maybe there's some that you feel confident in reaching and others that you really struggle to reach. You're not really sure how to cut through the noise in a particular audience. So yeah, I see a lot of community members, partners, local media outlets. That's a great one. And then, yeah, getting really specific about like, maybe there's a geography you're having a hard time getting to. And this is really where like the nuance of this comes in. So Danielle, if you could do one more click. So the next step from this would be taking a look at that information you're gathering around your audience, and then getting really clear on the message around what do you need them to know, learn, or do. And oftentimes there is, really grounding in the goal of what you want the message to achieve is something that is sometimes not really articulated. Like, you want to say something, but you're not exactly sure. And then is there a specific call to action? Are we trying to get folks to engage with a resource, take an advocacy step? Are we trying to get them to donate to your organization? And then what is the most compelling, accessible message that would lead people to action? And so that process of going from audience to message is critical. And then you can click one more time, Danielle, before we even get to the final stage, which is then once you have those two things set, then you can think about, okay, now that I know this, how might I think about, especially when you have limited resources, where that information goes? You know, like it may be that you find that that particular audience you're trying to reach is really not on digital channels and they really want more in-person connection. And so you might need to do like more in-person monthly stand-up with a group of individuals and go find where they are and meet them there. There may be really active Facebook groups where most people are getting their information, and that's where you see people living, and you need to tailor communications for that channel. But without these first two pieces, the end point and the materials, they won't matter as much because you want to make sure you're going where they are and it's aligning. I think there's one more click just to say that this is where we're going to focus a little bit today, because foundationally, the practice of understanding how to what you want to say and how you want to activate people and what you want to get across is going to feed everything else that you do. So you know, it will be the foundation for how you move against a campaign, how you move against developing a resource, how you decide to reach out to the media. So this is where we're going to really do some practicing today. I'm just flipping through the chat here, but okay, yeah, next slide. Okay, so in this exercise that we're going to practice, before we get started, I guess another question we have for you is, what is a key message or story you're struggling right now to share or advocate for right now? So is there a particular part of your work where you're really like, I know I want to say something here, I'm not really sure how, or I really want to activate this certain group or gain attention around a particular body of my work? Yeah, upcoming changes in Medicaid is absolutely something on a lot of people's minds. You know, we hear a lot about all of the headlines that we put in the earlier slides. There's no lack of issues, right, that we want to talk about, but I'm teeing you up because we're going to do a little exercise. So I want you to start thinking about, you know, something that you might want to practice on. Is there a particular, initiative or piece of work or upcoming challenge that you are trying to turn over? Access to resources, reaching those with less access. That makes a lot of sense. So let me walk you through the exercise. So Danielle, we can go kind of one by one. This is like a click through here. Reaching parents around reproductive education. Yep, that's a big one. So the framework that I'll introduce is one that you will be able to apply in any context around basically anything you're trying to message. And it really, again, if you think about it, if you stop and walk through this exercise, it will sort of give you the foundational bullet points, talking points to get you started, to then think about, all right, where do I want to push this message out? How do I get it out? But this is step one. So the first piece is envision in your mind what you want the key takeaway for your audience. What do you want them to know or do? And I'm going to walk through 3 different examples of this in application, so you'll be able to see this. And so getting really specific about this, like not saying broadly, I know I want to reach this group. Okay, but what are we actually asking them to absorb? How do we want to change their thinking, or how do we want to use our role as a trusted resource? And I know we talked a lot about like the folks that have that trust, you know, like you all are in your communities. You've done a lot of that active listening, like a lot of the time, the stuff that Scott and Becky were modeling, that is happening. And so in a lot of ways, like you are the trust holders, and that the information you're providing to a particular audience could really activate them to move on something. Okay, so the next piece, Danielle, is just one more click. Yeah. So the next part of this is, I'm calling this a news hook or a hot button, but it's really the point around why should they care about this now? And this isn't to develop like a false sense of urgency or really not trying to fan flames of fear at all, right? But this is really to put the conversation in context. So, you know, why should I care about this now? What is happening in the world that you might want to share with somebody to bring this into, into focus for someone? And as somebody was saying earlier, there's no lack of things to think about or action on or read about. What would make this rise to the top for somebody, right? How do we connect it to deep values and concerns and opportunities for the audience that you're trying to reach? Okay, next one, Danielle. And then, so then the next part of this is narrowing your message to a couple anchor points that build. So who is feeling the impact of this? And this is really because some folks will need a little bit of evidence to back up the news hook and sort of like, why is this important? And so having a couple key pieces of information, and again, we saw Scott and Becky do this really nicely in their example where they're kind of laying out, well, here's some information that I can share that might offer a different perspective that would reinforce like why something might need attention or why we might want to take action on this now. And that takes a little bit of thinking and just making sure that the points you're raising are the ones that you think will really resonate with that particular audience. Okay, next piece. And then it's always good to think about, as one of the final pieces of this, is there a way of bringing this to life? And I'm using the term, quotable soundbite, but it could also be a longer story or just a paragraph that explains a little bit, putting it in somebody's life experience. So if you can think about these two bullets, one is sort of the head of it, right? The data points, the why is important. And this one is a little bit of the heart, right? Like what's actually happening in people's lives that could be impacted. And this is a place where we want to give voice to the folks that have the lived experience of these issues. The idea that there's a lot of care and dignity and warmth to what's happening. And also sometimes to put a finer point on the risk of not actioning on something, or the risk of so that people understand why this story is so important, and that you really want to kind of make a finer point about something. The quote really does help. And some of those, we don't want to manufacture, but they come from conversations in your community, right? Like the more real these can be, the more authentic and compelling they will be. And then the last part of this is, as you're working on this frame, there's one more click here, is really to think about kind of after you've walked through this. So Danielle, one more here. After you've walked through some of this and started sketching out the message platform, doing a little bit of a equity and bias check, right? Like, let's take a look at the language that you're using. Is anyone left out of the message? Are there any stereotypes? Are we causing any harm with the type of story we've created? And sometimes you will go through this and realize, okay, I might want to shift the framing on some of this because it's either putting something in a deficit frame or reinforcing a stereotype, or maybe there are certain words that when you were thinking it through sounded good, but then could lead folks to some kind of negative connotations. And so that is just sort of a last step that isn't necessarily in the bullet points, but it is something to kind of review and think about. All right, I have this platform, and how does this feel? And how will my community respond to this? Like, does it feel like it's connected to the folks on the ground? So I'm going to walk through a couple examples, and then we're going to I'll give you guys a chance to try the exercise on your own, so that you can practice messaging about something that is, challenging for you or something you're thinking about. So if you go to the next slide, so this one, and again, Danielle, these kind of click through one by one. In this one, I was giving just a high level example of, like, say you just want to talk about an initiative you have going on. And in this one, I'm using an example of a food program that we ran in the Boston area. So the first part of this is, if you click through, is what are we trying to get across? And the way we framed this is that there's a tremendous opportunity to innovate around food systems in Boston. We can move from stopgap solutions to sustainable community-led efforts that ensures everyone can easily access the food we all need to be healthy. So this is what we want people to know. Danielle, the next part of this is the hot button, right? So why is this important? Food insecurity grew quite a bit during the pandemic. There were communities that were harder hit, and food providers were struggling, and families were confused about where to go. And so there was like a lot happening in the food security space as a result of the pandemic. It still continues today. So again, we can update any of these stats, but this is really like, why is this an issue now? And then the next part of this is are some of those details. And so when you're describing the work, what were we able to do? Like, what are our points around this? So we created a food action committee across 4 areas of Boston. Community members are leading these efforts to connect and coordinate food resources in new ways and offer food navigation support. And since launch, we've served 20,000 families. So this is a little bit of like your pitch, right? Like what is happening here that is, really changing things for people. And the last part of this would be a quote from somebody in the community. In this case, we used our community leader who talks about what this means to him and how he sees it making a difference in his community. So again, this is like a little more simple around, okay, this is a program we're running, what I want to make sure we totally get across to somebody for them to understand what's really happening here and why it's important. But the next one takes us a step further into some of the questions that we have that I've seen in the chat and that I saw in the questions that we got in the registration form around like, how do I weigh in on like a trickier topic that could be viewed as political or, something that's happening in the federal landscape that is, something that's affecting my community, but is a little bit, tender to weigh in on. And so the example we're going to use here, and there's another one after this, but just so you can kind of see how it works when you're talking more about I use the term point of view, so POV. So our organization might want to actually issue something around what it means in the community. So for this one, Danielle, I can flip through, is we're talking about fluoride in the water, which is something that has come up for a lot of different communities. And so the takeaway here is, with the federal push to end the use of fluoride in the country's drinking water, local communities have an important role to play in protecting dental health. Our organization provides resources to help advocate for this important public health measure. Now, that might be more specific or less specific, right? But we're basically saying, like, we have a point of view about how this affects our community members. So the next point would be then the hot button, right? Like, why is this, important now? There's, without this national mandate or funding for this, a lot of local health departments are considering abandoning the practice, and low-income families will suffer most. And then when we get to sort of our the next one around the bullet points around the data, we have a lot here to really lean on here. So fluoride has long been proven as safe and effective. And a lot of Americans support fluoride, or they're not opposed to it. And it is a vital defense, particularly for children in low-income communities who are disproportionately affected by dental decay and often lack access to regular dental care. So even though this is a political issue, we're pulling through the information that we know and have from our community about how we know this might affect the people where we live. And then if we were to think about some kind of quote to bring it to life, again, this isn't maybe the most perfect analogy. If you go to the next one, something like removing fluoride is like tossing out smoke detectors because you haven't had a fire. It might seem fine until it's not, right? And for some families, fluoride is the only dental care that they can reliably count on. And without it, we widen this gap between those who can access and those who can't. And so, again, this might not be the most perfect analogy, but those do help people understand and think about why this issue might be important and what it looks like, and give folks another way of understanding it. And so again, once you have this frame, you can think about, all right, how might we want to translate this. If this is sort of the base, bullet points that we want to cover in some way, how do we translate this into a blog post? Or maybe it's the foundation of a pitch that we send to the media. Maybe we make this into an infographic for social media. So again, landing on what you want to say, how you want to say it is step one, and then thinking about how that translates is step two. I'm going to go through one more example before I let you guys try it. I'm sorry I'm talking a lot, but I want to make sure you have sort of some thinking. Again, these are hard issues, and I know that folks are concerned about drawing attention to them around some of these things, but the role you play in your community of being a voice for how these issues affect local areas is really unique and really important to uplifting. And you have more credibility than so many others who are not seeing how some of these things are playing out on the ground. And so in this one, again, it can be viewed as very sensitive, right? Like immigration is a really fraught issue. But the point of view that we're sharing is we know how the immigrants are crucial to our care workforce. So I'm thinking about all of the ways in which that workforce could be threatened. And so ensuring that immigrants have a legal and safe pathway to work is critical to care overall, particularly for a fast-growing elderly population. And so the next part of this, you can click through, Danielle, would be, again, something like, this workforce is already in short supply. Nursing homes have long faced worker shortages. This is a situation that has reached a crisis level, during the pandemic. And with some of the policies that are happening, nursing homes and care providers are losing foreign-born employees and struggling to hire. And so we're just explaining the strain that is going on in the care workforce, which so many of you are a part of or are connected into. And then the next part of this, there's really no shortage of stats around this. If you go to the next part, Danielle, you can kind of frame for people in different ways, right? We know that these workers make up a good portion of the workforce in different ways. Turnover will lead to higher costs, and we see this showing up our community in different ways. So kind of putting your pieces of this here. And even though we don't want to reinforce that immigrants are only valuable because of the work they provide, but this is more to say that in the healthcare space, they are an undervalued group and have been for a really long time. And this has been going on far, before the immigration policies. And so this is to help people understand that this is about a vital workforce that has always been here, and the, connection they have into the health of Americans that a lot of people are not aware of or seeing. And so the last part here is a quote around, again, this is just an example, but when these rules shut out care workers, it's not just jobs, it's all of the fabric of the society and compassion, cultural expertise, continuity, and dignity for everybody that's a part of this. So again, like this is an example, and there are ways that you can tailor this to fit where you are and what makes sense. And again, I see your comment that I do agree that immigration is not just about that they're our workers, they're human beings. I think there's ways that we can fold a lot of that message into this, but from the perspective of the impact that these policies are having on care, is a one way of talking about the issue. So again, you would want to tailor that to your perspective. So I'll pause there because I know we want to move on to the exercise and give you all a chance to try this. And so if you go to the next slide. So what we thought was that we could give you all a couple minutes to practice a pitch. It could be about anything on your mind that you want to start to practice messaging around. It could be a story in your community. It could be an initiative you're working on. It could be some of the things that you all raised in the chat, an issue you want to practice talking about. I welcome any other ways of talking about some of these challenging issues that are happening at the federal and local level, because these are hard to grapple with. You could practice having the vaccine conversation. There's a lot of things in here. I think people raised a lot about mental health. That could be one to practice if there's a particular message for a particular audience. So we'll give you all some 10 minutes to kind of work on this, and then we'll break out into small groups and you guys can talk about it. You don't have to share if you don't feel comfortable sharing your pitch. You could just talk about it at a high level. You can go through it with your small group if you want to, or you can stay in the main room if you prefer. So you guys have options, but I wanted to give you some time to really sit with what it would be like to do some of that foundational message work.
All right, welcome back, everyone. Hopefully you enjoyed having that practice opportunity. Sue, let's go back to you.
Sure. I know we want to leave some time for some Q&A here, so we can keep this quick, but I'm curious how that felt for folks, if people found it challenging, if it was a helpful way to kind of get your mind centered on a particular question or issue or message that you've been struggling with, if anyone wants to share. Or that if it was hard in your small group. I find it sometimes difficult when you're kind of formulating your ideas, but then when you go to share it, it can feel clunky. Did folks have any good feedback for each other? And sometimes like you might start on a particular issue and a frame and realize that it's really sensitive, or you might need to take it in a different direction, or again, when you do that equity check, like, is this like nailing the message you really want to give? Or, and also like on some of these issues, is there an element of risk that I have to evaluate if we go out with this? So curious if anyone had any thoughts. If not, we can kind of start moving to Q&A, but. Oh, very interesting. Yes, we use this a lot around op-eds because it really does force you to get clear on what your opinion is and what is new that you're saying from your perspective that's distinct from what anyone else can provide based on what your point of view is. Yeah, I'm hoping that, it's not something that is a really heavy lift that requires, a ton, but that is the light framing for you to sit down before you start thinking about what the campaign is and what the story is and what the op-ed is. If you're going to go out to a local reporter with something you want them to cover, to get organized, get clear, make sure it's something that can make its way through a lot of loud noise in the market. Yeah, I know. I feel like we never have enough time for some of this deep thinking work. I hear you, Ruth. We will definitely keep that in mind. I feel like we do that a lot, where we want to give more time and then feels like it goes by quick. And that is something that we will want to hear about for future trainings, if more space and time might be needed just to work together on things and hear from each other. That is also a space we can think about providing more of as we have 2 more trainings upcoming. That's great. If you're already in a place where you feel good about the message and you're thinking about that next step, that's a great place to be, like starting to brainstorm what could this translate to externally that you think people can engage with, and really maybe using it as a backdrop to do some of the work that Scott and Becky were talking about, like how to have that conversation, how to bring people in. Okay, I'm going to because we have one more poll that we want to throw to you all, and a quick resource we wanted to share with you before I wrap up, and then we're going to move to some Q&A. So we are really curious. Obviously, there's a lot to cover in communications, and we're happy to dive in anywhere you all need. So we're curious of the things on this list, sort of what jumps out at you the most. I know there's a lot of things that we could cover, but we want to design around you all. So take a quick minute here to weigh in. And if there's something that you don't see here, please just put it in the chat and we will record it. The resource that we are going to share is also like a checklist for communications work overall. So I think that on the strategy and goal setting side, that is a helpful resource. And we also have in the works, and we're thinking about when to share, is a advocacy and issues response guidance, like a template that you all could use to help guide like that decision-making process around when do you weigh in on something versus not, and then when you choose to, what does that look like? It helps you evaluate the risk and externalizing a message. So that's another resource that we're creating. So I'm happy to see that that seems like something that would be of interest to folks. That looks like 50% of you are interested in that. And I think the strategy and goal setting is very real, right? It's really hard to even get to the messaging step if we're, not clear on what do we need communications to achieve at a high level? What does it need to do for our organization? So I do think that that is a whole separate conversation that I think would be useful too. All right. Thank you all so much for responding. This is going to be really useful as we plot out the next few trainings. And yeah, just really appreciate your input here.
Yeah, and thank you, Sue. I think that was such a rich presentation, as well as having the time to, think about how would I say this, especially when you're working in public health or healthcare, social care, community health, right? We have to be intentional about thinking about how we're crafting messages. Who is our audience, right? What do we want to say to them? What's going to draw them in? So I appreciate the points that you gave about what do you want folks to walk away with, right? What is that takeaway? What should they care about? What's the news hook or that new term, the hot button? Right? What are the anchor points? What kind of data points are there that we can share to really help amplify that this is something that's been researched? There's data out there, and also the key points that you mentioned about bringing it to life, using a quote or some type of audio piece, right? And then thinking about who's being excluded, thinking about that equity checkpoint as well. And sometimes there is some unintentional exclusion that's happening in our messaging. So it's key to think about that as well. So now I think we're ready for our Q&A, and we're going to bring all of our presenters back onto the screen. And, we really just welcome any questions that you all have. I know someone had shared in the chat earlier about how do we get our message out, but stay off of the radar, right? There's a lot of things that are happening about, oh, don't say this, don't talk about this. So, when folks are looking to really share out messages that are important with their audience, but not really wanting to put themselves out there too much. How would you all recommend that they get that message out without being targeted? Anyone's welcome to jump in here as well.
So in terms of, so this is for us, right? Yeah, so in terms of getting out messages without being targeted, I think that's a really difficult issue that depends on a number of factors. And I'm going to speak partly from my own position and organization that I'm in. I mentioned earlier that I come from the role of wearing multiple hats. One as a research dean, another as a senior editor for the journal, and another as a researcher and someone who's active in community health strategies from that lens as well. And so to that end, and I know many of our participants today also wear multiple hats. So to that end, I would say first and foremost, it depends on the context. I also think there's a strong advocacy role. So one of the things that I recommend is find trusted partners and trusted voices and advocates that can work with you, which I do note is a challenge. And so I put a little asterisk on that because it is a challenge navigating institutional policies. It's a challenge depending on where you're located. It is a challenge. I know that I think the vast majority of us, please do correct me if I'm wrong, are located in the United States. And so right now, many of us are facing many similar challenges in terms of navigating some of that. And so I think there is a context element and there is sort of an audience element to navigate, and finding trusted partners, organizations to work with, and to reach out to those and find those voices that you can go to. So one of the things that I do at least is, and I posted this in the chat here as well, was I note that I like to note that my office, and I do this for students and for others that I meet with, is say that this is a safe space, and conversations that happen here don't leave the room, and try to engage with what are strategies that we can use moving forward. And so to that end, it's a very difficult challenge. It is very difficult, and I note that there's not an easy answer.
Yeah, I'll just plus one that, and I think this issues advocacy guidance document that I referenced might be something that we want to uplift because it's an example of how you might frame that decision-making process, right? Depending on your status as an organization, you are limited in, like lobbying or, depending on where you are, right? There's a fine line between what could be a violation of sorts versus just, we don't want to make noise about this because we don't want to call attention to it for us. And there may be a really good strategic decision why you choose not to weigh in on something externally. And it's more about how do you make that decision? Like, what's the decision tree there? And so that may be a resource we might want to advance sooner rather than later that I think folks could gain a lot from. But it is very individual. It's very also moment to moment these days where you really can't have a blanket strategy. Like, we're going to weigh in on these things and not these things, because I think it is very dependent on the moment in time, what the risk is to the organization, which has to be kind of evaluated in real time, which takes more resources than I think folks typically are used to right now. Feeling that.
And I think Becky and Sue have both said exactly the challenges we face. And I think what this checklist resource, the other resource that Sue is referring to, is to remind us to be proactive, to have a plan, to have community engagement, to have a network of trusted partners and influential, and also to do the influential, if I can say, on the other side, or those that might not be helpful to your message. You're able to both monitor, listen, and be able to respond to your community if they have questions related to that. I do think the pieces in the chat are right. I mean, Becky has mentioned the safe space. We would like to have HECC as the safe space and belonging, as Jacquelyn's mentioned. This one was recorded because it's for educational purposes and will be the ability for all of you to use again. But in the future, I think we can have some of the open discussions as well. And I think even all of you in your own communities, whether it's with us or with others, use the electronic communication, as possible, so it's not turned as much as possible, so it's not turned against you. And at the same time, as Sue was saying, pick your battles. Some of this is ongoing. The hill is going to be steeper in some places, but it's still pushing a rock up the hill. And sometimes the rock is going to get bigger and bigger. And all in all, we need all of us together to push that rock. So let's find ways that we can find the right people that we want to align with, and hopefully have a positive progress at the community level and beyond.
Yeah, I really appreciate that point. There's some really good questions in here that I just want to really emphasize that on the role of safe spaces that are no longer safe. Well, I know this is a completely different issue. One of the things that I just want to very briefly mention, I'm mindful of time, that I faced in my own institution, and I have no problem saying this because it is very, very public in the news, is many states, like my own, with the removal of DEI practices, that meant I had to revise all of my documentation, and we had scalpers. This relates to one of the questions asked earlier today, scouring our university site, looking to kind of come after us, and especially deans and other leaders and community advocates. So those of us working in healthcare in particular really faced a lot of that last fall. And so there were a lot of things in that to unpack. So happy to talk through some of that further if we think there are additional listening sessions or conversations or ways that others feel like they want to discuss that. I'm glad to discuss much of that further. I think there's a lot to unpack there. That's just one example.
I know time is against us as well, and I'm going to ask one question that I've seen is, Sue, I think you mentioned the various audiences that folks might be messaging to. And I think one question that's come through is about how do you message to a diverse bunch of audiences, especially when you think about community members? That's a diverse, very general and broad group, right? So how do you craft a message when you're looking to address multiple communities of individuals?
I mean, my rule of thumb is as simple as possible. Really evaluating again and again, is what you're saying something anyone could understand, that it could capture as many people as possible, meaning not over saturate or use heavily academic language, or there are guidelines too around like making sure things are accessible at all reading levels, and incorporating translations as much as possible, as much as your budget allows, for the types of communities that you're communicating to. So it actually does take a very intentional slowing down, actually, that is counter to how we feel about communicating a lot of the time when everything feels urgent. But it actually does take a pause to say, okay, like, is this going to reach and include as many people as possible? And when that's not possible, think about really targeting and saying, okay, this is our base message. We're going to go out this way to these people and this way to these people. And sometimes that is a more equitable way to do it. So I think it is a real like case by case, but having that lens on of, who are we going to leave behind in this message if it goes out this way? And where are you on some of your bigger things, testing that out with the people in your community and really letting them tell you, yeah, this makes sense, this works. So those are some of the things we try to do when we can, because it is, I feel like a lot of people are up against the clock. They feel like they have to get things out, but as much as you can build that into your process, it's helpful.
Thank you, Sue. I know that Rebecca and Scott, you probably have something to add to this, but we are up against time. I think we haven't had as much time as we had hoped with our Q&A, so we will work on that for next time. We are launching a poll about just, to think about to see what your experience has been on this training. And as we come to a close, I just want to take a moment to say thank you to our speakers, Dr. Rebecca Ivic, Dr. Scott Ratzan, and Sue McCarron, for sharing their time and their expertise with us today as much as possible. I think this has been a very valuable time, and I hope that you have felt that way as well. As I mentioned previously, we will be sending out the recording and resources in the coming days, and I hope you will plan to join us for our next training as well. We hope to release that date or have that date posted in the follow-up resources, so please look out for that. As a bonus, you may have seen this, but anyone who attends all 3 of these sessions will be invited to participate in a small working group to get continued practice skills, peer support, professional guidance. So that is for those individuals who are planning to and able to attend all 3 sessions. And again, I think there's one other resource. If you have not seen it, there is a resource that we recently released with the Legal Defense Fund of the NAACP that is a myth versus fact resource. I don't know if our team could drop that link into the chat for us, but that is a resource that is guidance around how to navigate health equity, the health equity space as it relates to some of the executive orders that have come out recently. So welcome you to look at that resource and review that. That might be helpful for your work as well. So as we're wrapping up, again, I just want to say thank you for your presence, your questions, your energy, your comments in the chat, and your dedication to this work. It's really, grateful just to have you all here for this session today. And we hope to see you at the next one. Thank you all and have a great rest of your day.